Hey everyone, and welcome. If you're prepping for your MBBS exams, you know Staphylococcus is a huge deal. So in this explainer, we're going to cut right to the chase and focus on exactly what you need to know to nail those questions.
So here's our game plan. First, we'll figure out how to spot the culprit. That's identification. Then we'll look at its weapons, the virulence factors. After that, we'll cover the crimes it commits, the clinical infections. And finally, we'll see how we unmask it in the lab.
Okay, let's jump right in with the absolute basics. Picture this. You've got a slide with some gram-positive cocci. Where do you even begin? Well, it all kicks off with one super simple test.
Think of this as the first big fork in the road. The catalase test splits all these bacteria into two massive families. The one we care about today, Micrococcaceae, where our friend Staphylococcus lives, is catalase positive. You add a drop of hydrogen peroxide and boom, bubbles. Streptococcus, on the other hand, catalase negative, no bubbles. See? Easy first step.
Okay, so we know it's a staph, but how do we single out the main villain of the story, the most dangerous one? It all comes down to one absolutely critical test, the coagulates test. And it does exactly what it sounds like. It checks for an enzyme that clots up blood plasma.
And this is the money slide for your exams, folks. This one test splits the whole genus in two. You've got your coagulase positive guys, which is pretty much just Staphylococcus aureus, our main pathogen. Then you have everyone else, the coagulase negative staph, or cons for short. And these are way, way less nasty.
All right, so now we know who it is. Let's get into what makes S. aureus so darn good at causing trouble. It's time to open up the armory and check out its virulence factors.
And wow, S. aureus really comes packed with an impressive arsenal. We can break it down into three main categories to make it easier to remember. You've got stuff that's physically attached to its cell wall, then you have these powerful toxins it just shoots out, and finally, a bunch of enzymes it secretes to chew through tissue and dodge your immune system.
Now, if there's one virulence factor examiners absolutely love, it's protein A. Seriously, star this one. Think of it like an invisibility cloak for the bacteria. What it does is kind of genius. It grabs onto our antibodies, but it grabs them by the wrong end, the FC region. It basically flips them backward. This completely messes up opsonization, that process of tagging a bad guy for destruction, so the immune cells just can't see it.
Okay, let's talk toxins. Each one is tied to a classic disease you gotta know. First up, epidermolytic toxin. This is the one that causes the skin to literally peel off in staphylococcal scalded skin syndrome. Then there's the enterotoxin. This one is preformed in food, which is why food poisoning hits you so fast. We're talking just a few hours. And finally the big one, TSST1. This is a super antigen. It sends the immune system into total overdrive, causing a massive cytokine storm and, well, toxic shock syndrome.
And this brings us full circle back to coagulase. See, it's not just a handy lab test. It's one of its best weapons out in the field. By spinning a little cocoon of fibrin around itself, the bacterium can literally build a wall to hide from your phagocytes. It's pretty clever, right?
Okay, we've seen the weapons. Now, let's look at the crime scenes. And S. aureus is an incredibly versatile criminal. It can cause trouble pretty much anywhere in the body, which leads to a massive list of diseases.
I know, the list of infections can seem overwhelming. So to make your life easier for exams, we've got a great mnemonic for you. Just remember, soft pains. Let's break down what each letter stands for.
First up, S is for soft tissue infections. Honestly, this is the bread and butter for S. aureus. It's what you'll see most often. We're talking everything from a simple infected hair follicle, that's folliculitis, all the way to big, nasty abscesses and boils, kind of like what you're seeing here.
Okay, let's keep it moving. O is for osteomyelitis. And remember, S. aureus is the #1 cause of bone infections. F is for that super fast food poisoning we talked about. T stands for toxic shock syndrome, thanks to that super antigen. And P is for pneumonia, especially the kind that shows up in patients on ventilators.
And to wrap up our mnemonic, A is for acute endocarditis, which can just tear up heart valves. I is for infective arthritis, an infection right in the joints. N is for the terrifying flesh-eating infection, necrotizing fasciitis. And that last S, it's a 2-for-1, scalded skin syndrome, and of course, life-threatening sepsis. So there you have it, soft pains. Get that into your head.
Okay, switch gears. You're in the clinic. A patient comes in, and based on everything we just talked about, you're thinking, this could be staph. How do you actually prove it in the lab? Let's walk through that diagnostic pathway, step by step.
The lab diagnosis follows a really clear, logical flow. First things first, you got to get a good specimen, right? Pus from an abscess, a blood sample, whatever makes sense. Then we take a peek under the microscope. After that, we try to grow it in culture. And finally, we run some specific biochemical tests to nail the identification.
So under the microscope with a gram stain, S. aureus has a classic look you just have to know. We're looking for gram-positive, so they're going to be purple, cocci, and here's the key part. They're arranged in these grape-like clusters. You can see it on the left there, mixed in with pus cells right from the patient, and on the right you see a nice clean culture from the lab.
Now, when we grow S. aureus on a plate in the lab, it's got a couple of dead giveaways. On a basic nutrient agar, it forms these beautiful golden yellow colonies. In fact, aureus is Latin for golden. Then, if you put it on blood agar, you'll see beta hemolysis. See that clear zone? That's the bacteria literally popping the red blood cells.
Okay, so we've got purple, grape-like clusters, and golden colonies. We're pretty sure we know what it is, but how do we make the final definitive call? How do we prove it's S. aureus and not some other staph? Well, it all boils down to two key tests.
And look at that, we've come full circle. It comes right back to the two tests we started with. First, the catalase test. We add peroxide, it bubbles, we know it's a staph. That confirms it. Then the all-important coagulase test. If that's positive, that's what clinches it. That's how we separate the king, S. aureus, from all the other Staphylococcus.
And here's what that positive coagulase test actually looks like in the lab. The slide test on the right shows you clumping. It's fast. But the tube test on the left is the really definitive one. See how the liquid plasma has turned into a solid clot? That's our gold standard. That clot tells you, without a doubt, you're looking at Staphylococcus aureus.
So let's just hammer this home one last time. The whole diagnostic flow. You get a specimen, pus, blood, you name it. Under the scope, gram-positive cocci and clusters. On culture, golden colonies with beta hemolysis. And the final ID, catalase positive and coagulase positive. Simple, logical, and absolutely how you.